Dr. Vishal Bhambri. I'm a senior consultant in internal medicine at Fortis Hospital, Mohali. So today I wanted to speak something about obesity and its link to lifestyle diseases like diabetes, hypertension, high cholesterol, and obstructive sleep apnea. A lot of my practice involves diabetic patients. About 50 to 60% of my patients are diabetics. So I have special interest in obesity as a cause of diabetes per se, and its reversal or a partial reversal with a correction of obesity. India is almost the diabetes capital of the world. ICMR INDIAB study, which was done here among all states and union territories, Chandigarh was found to have a very high prevalence. So, obesity, we have to understand that major link is with the diet, and so if you're eating too much, nobody can help you. So, you have to restrict your caloric intakes to remain, among your ideal weight. If we do not, then we are at risk of pre-diabetes first and then going on to diabetes. If we are pre-diabetic and obese, then if we lose weight, we can go from pre-diabetes to non-diabetic state. If we continue to be obese and we are pre-diabetic, and then we go on to become diabetics, right? Similarly is the thing with pre-hypertension and hypertension. If we lose weight or medications for diabetes and high blood pressure and for high cholesterol, these all go down. And particularly in bariatric surgery, it has been seen very clearly that if you lose a significant amount of weight, say you lose 25 or 30 kgs or even more weight with bariatric surgery, then lifestyle diseases like diabetes, hypertension, dyslipidemia can be reversed. People have cured diabetes by undergoing bariatric surgery. The same thing can be achieved to a lesser extent by diet control and exercise also. If you're consistent with a low calorie diet and you do brisk walking or exercise, you will maintain ideal body weight. So idea is not to just increase life expectancy. Nowadays obviously life expectancy is increasing with increased better treatments and all the other things, but the idea is to live healthy also, long but healthy also. So if you just live long and you are unhealthy because of diabetes, hypertension, dyslipidemia, obstructive sleep apnea, coronary artery disease, then there is no point. But if you're healthy even at 60, even at 70, 80, then obviously life is very good for you. I have a lot of patients between 80 to 100. So I consider now 40 to 60 to be young patients. Actually 60 to 80 middle age, and more than 80 only I consider old, because there are so many patients more than 80 now and between 80 to 100. But if you live up to that age, you will only do that if you prevent this obesity and you maintain your ideal body weight. In diabetics particularly, we know that if your parents are diabetics, if your sister or brother is a diabetic, you are at very much high risk of developing type 2 diabetes. But if your parents are diabetic but you maintain your ideal body weight, you can at least delay the onset of diabetes. If you are obese at 40, then and if your parent is one of the parents is a diabetic and you're obese at 40, you'll develop type 2 diabetes at 40 itself. But if you maintain your ideal body weight, maybe you can delay it to 50 to 60. Eventually it will happen, but it will happen much later and it will happen to a lower level. So that is the benefit which we can get with weight reduction. Thank you.